oftentimes they'll see 4 or 5 or 6 different doctors before they actually get diagnosed with perimenopause. They'll oftentimes get they'll get antidepressants, they'll get pain medications, they'll get sleep medications, they'll get anti-anxiety medication. Like, they get all these medications prescribed to them because they're having this vast, amount of symptoms. This is all happening because of one thing, which is that your ovaries are just kind of petering out.
The hormonal landscape today is so confusing. Ladies, I don't know if you feel this way, but I feel like everywhere I turn, there is different advice about what I am supposed to do in this season of my life, as I guess I'm a perimenopausal woman. I'm super thankful because I think of like our moms going through this process. They had no information as to what can happen and how we can feel based on our fluctuating hormones. I love to joke that our moms literally raw dogged menopause. And that had to be really tricky because I've experienced enough of some hormonal fluctuations that you literally feel crazy. And probably when they were going through this, they were told that they were. And so while I'm so thankful that we have an abundance of information and that the science and research is finally starting to look at us as women and our hormones, I am also extremely overwhelmed. And so I'm wondering if you feel the same. And in this next episode, my goal is to help create some clarity for all of us. I recently brought on an expert that was very much for not using any exogenous hormones, meaning not taking any hormone replacement therapy. She's a world-renowned integrative oncologist, and her episode is honestly one of my favorite sit-down conversations that I had. And now what I'm going to do is I'm going to bring in another expert. This woman was a former ER physician and brilliant woman. She's in the hormonal space, and she is very much for what she calls hormonal optimization therapy. And so although it's kind of confusing maybe that I'm bringing in two very differing opinions, I think this is a really important conversation because the reality is this is what we're surrounded by. We are surrounded by conflicting information and data. And so what I have come to in my life is there is not one size fits all. There is one size for you and for me, and those are going to be vastly different. And so my hope and goal in bringing in these experts is to expose you to some really high quality knowledge, some amazing science, and also some brilliant minds that also firmly believe in the power of the body the way that I do. These women are all about root cause and not just treating the symptoms, but working with the whole body and the whole system. I always aim to bring in real women, the kind of women that you'd want to meet for coffee and have combination of, science meets the soul. It's like sitting down for a tea or coffee chat, but getting some really good clarity and information. And so as I interview Dr. Amy Killen, my goal is to pull some information, clarity, and answer my questions that I currently have as a 44-year-old woman navigating this extremely overwhelming landscape. And my hope is that in doing so, I answer a lot of yours too. My aim is for you to leave this conversation empowered with some clarity and with some answers to the questions that you have. Now, as always, we've got to build this village together, and we're all experiencing the same thing. And so I highly encourage you, if you're watching this on YouTube, use the comment section, post your questions, post your comments, post what you're doing, maybe post a takeaway from this episode, ask your questions. I closely monitor all of that. If you're listening to this on audio, reach out, email me. Let's do this together. We are so much stronger together. And again, this is a very confusing time. But I think as long as we're leaning on each other and sharing what works for one another and building our own map based on our wisdom and what we know to be true, we've got this. All right, Dr. Amy Killen, thank you so much for being here. I am really, really looking forward to this conversation. This is such an important topic that we all are so overwhelmed about. So thank you for being here.
Thank you for having me. I'm excited.
I really want the listeners to get to know you before we delve into this and you help us simplify all the information out there. Like, I don't know which way to turn as far as hormonal support. And I feel like I'm pretty educated as far as my postgraduate education, but I really want to get a better understanding of kind of like, why did this topic become so important to you, and what is your goal on your platforms or when you speak on stage? Like, ultimately, what pain point are you aiming to solve for all of us overwhelmed women?
Okay, I love that. Well, my journey out of the ER and into this field of medicine really started from a place of just being a very overwhelmed mom. I was an ER doctor for 10 years, and towards the end of that, I had three kids within 2 years. So I had twins plus one more 20 months later. And my husband moved out to a job out of state when my third son was a week old. And so I was, this kind of primary caregiver to three kids, and I had to be at work at 4 in the morning for my ER job. So you can imagine like not sleeping and not working out and super stressed and, just all the things that happen when you are a mother anyway. And I did that for a few years and got to a point where I just realized if I didn't make some pretty big changes in my life, I was going to be a patient in the ER, with some kind of chronic medical problem or stress or overwhelm or a mental breakdown or something, soon because I really wasn't taking care of myself. So that was 2013. And I decided at that point to start learning about, kind of other tools, how to be healthy, ultimately started learning about hormones, which I think are really important, but also lifestyle and how that affects health. And I made the transition into this field of medicine that I practice now, which is a lot of integrative medicine, hormonal medicine, and I do some other things as well. But that's kind of my focus now.
Okay, and so you are in practice, you're working with patients, clients as far as hormonal support and peptides. Is that your main focus? Just so I kind of know as I'm picking your brain on these topics.
Yeah, so I have a couple of practices. I have a stem cell practice where I just see stem cell patients, focusing on like musculoskeletal health, joint pain, aesthetics, skin, hair, sexual health, those kind of things with stem cell therapy. And then I'm also the owner in a couple of different clinics and franchises that are kind of integrative medicine and health optimization. So we see men and women, but we treat, essentially we do diagnostics and hormones and peptides and all these advanced therapies, but essentially trying to prevent illnesses and then make people feel as good as possible. So I don't see patients at those clinics, but I create all the clinical protocols and I train all of the new medical providers.
Okay, so you've essentially really seen it all from emergency medicine, chronic illness to now kind of flipping the script, so to speak,
Yes.
and helping people optimally live and not just not be sick, but feel really well as we age.
Yes. And I focus now, at least when I speak, I do a lot of speaking and I focus mostly on women's health because I'm a woman and I'm, kind of that midlife woman person. And then also my mom she's broken a hip. Like I've seen kind of the failures of the medical system and how we treat women and how we don't do a great job of listening to women. And so in the last few years, especially, I've focused more on my content and speaking on women's health because I do think it's such an underserved area of health.
It really is. I was saying in intro too, I'm so grateful that that's changing, right? I'm so grateful that we're finally becoming more of a part of the research. I know for so long women weren't even studied because we're so variable. Like you cannot control us with our fluctuating hormones.
Right.
And at the same time, like we are now living in the age of information and knowledge, and I'm so overwhelmed. I'm so overwhelmed. And so I'm really excited for everyone to hear this. And selfishly, I'm really excited to get some answers to these questions that I have as a 44-year-old woman. And I've been spending some time with my girlfriends and I'm like, you guys, what do we need to know? Like, how do we simplify this?
Yeah.
So my first question, kind of comes from my chiropractic lens. And, I really have this incredible innate trust in the human body. I know you share that. I've watched a lot of your stuff. I've seen you speak. So why are our hormones going down and disappearing? Why is it a problem if that's naturally the trajectory of our life at this age?
Yes. Well, there's certainly debate about whether it's a problem. Some people say this is natural and it's not a problem and we should accept it. My belief is a little different because I think that, we were not designed originally to live to be 100 years old or 100, 95 years old. And interestingly enough, humans are among the only species where I think it's us and whales are the only species of mammals that go through like a menopause where we stop making vital hormones like midway through our lives. Other species do stop reproducing, but they continue to make the hormones that are really important for continued strength and cognitive function and all of those things. But for some reason, and I don't understand why, but we, at age 50-ish, during menopause, we stop making estrogen and progesterone. And those are undoubtedly important hormones for full body health, not just for sexual health and reproduction. So I don't know why it happens, but I know that there's a lot of benefits to hormones. And we also know that women who go through early menopause or have premature ovarian insufficiency, where this happens earlier in their life, those women have more diseases and they die earlier. And so we have lots of data on this. No one has, people don't tell women that because they just don't want to scare it. We don't want to scare you. At the same time, we now have the ability to replace these important hormones in most women. And so I do think it's worth a discussion at the very least.
For sure. Yeah. And I love that approach. I appreciate it. I also love, I've heard you, take the phrase of hormone replacement therapy and you call it hormone optimization therapy. So what is the difference in that?
There's a lot of names for this, and I will say there's like whole Twitter boards about like arguments about this, but I call it hormone optimization therapy, or HOT, because I think that we're not necessarily trying to replace your levels to what they were when you were 25 or 30. Like, we're not trying to get you to cycle again and have periods again and all of that. We're also not just treating you when you're in menopause. So menopause hormone therapy is kind of the official language that is the guidelines recommend. But we're not just treating women in menopause. We're also treating women in perimenopause or in premenopause, people who have, PMS, or they have anxiety for their periods, or there's a whole number of things that we can use some of these hormones to help with. So my language is more about, we just want to optimize your hormones, not stop you from making your own, and not necessarily get you back to your 25-year-old levels.
That sounds good. That sounds healthy. It sounds like a both and, right? It's not one extreme or the other. It's
Yeah.
a little mix. So for a woman, I guess, middle-aged, which is the majority of the people probably listening to this, what are kind of the first signs? Because I think we all feel a little crazy sometimes. We
Yeah.
all feel a little tired sometimes. We all feel a little depressed sometimes. These are like the healthy spectrum of human emotions.
Yes.
How do we know when there's something deeper going on under the hood as far as our hormones?
It's really funny. I was watching this Instagram video with this guy, this like middle-aged guy. He was talking about, he's like, how come women get to talk about perimenopause? Like, they complain about all these things falling apart and they blame everything on perimenopause. And he was like, why aren't we just calling it aging? Like, I'm aging too. Like, you're just aging. This is not your hormones. Which, I disagree with some of that, but I thought it was really funny. There's so many symptoms, but I will say, if you're premenopausal, that, when you're still having cycles, one of the biggest symptoms of a problem is your cycles have become irregular or painful or really heavy, or associated with some bad sort of premenstrual symptoms, anxiety, insomnia, pain, any of those kind of things. Like, your cycles should not be something that puts you in bed or make you miss work, and they should not be unpredictable, and you should not be missing months. Like, the cycle is really there to tell you what's going on in your body. So in premenopause, all of that can indicate a hormonal issue, not necessarily that you need replacement, but that something else is going on. And then in perimenopause is the like 2 to 10 years before menopause. And so it can start as early as 35 and still be considered normal. It can start even earlier if you happen to go through premature ovarian failure. But perimenopause is when you start to have some fluctuations in your hormones, estrogen and progesterone, that can lead to a number of like wacky symptoms. Certainly things like hot flashes and night sweats we see, but also, palpitations, or really dry skin, or my eyes are so dry and they're itching all the time. So it is like a range of 30 something symptoms that can happen. But one of the clues is that it's happening, like, it just kind of starts out of nowhere. Like, one day you're looking yourself in the mirror and you're like, who is this person? Like, I don't recognize this woman who's looking back at me. And I've changed from a year ago or 2 years ago. And that's one of the things that I see a lot in practice.
Okay. And then, so when those things start to happen, where do we start? Where do we even begin? It's like, I
Yeah.
feel uglier. I feel perhaps less sexually interested.
Yeah.
I feel anxious. My joints hurt. Like, life
Yes.
is falling to shit. And now we have to try to figure out what to do. All right, I'll get back to the episode in just a second. That voice in your head is not just your thoughts, it's your nervous system. It's wired by your parents, your past environment, your teachers and preachers, which means a lot of what's running your life isn't even yours. And that's why you can be doing everything right, checking the boxes, showing up for everyone, but still feel overwhelmed, reactive, and like your life doesn't feel like your own. This is exactly what we're going to unpack together. When you order my book, The Connection Code, which is out now, you'll get access to a live 1-hour webinar with me. We're going to take this concept, the inner voice, the patterns, your nervous system, and actually break it down so you can see what has been running your life so that you can finally understand why you get stuck in the same patterns, why you react the way that you do in real time, and how to start shifting it without fighting yourself. Because awareness is the shift. When you can see what's happening inside your nervous system, in that inner voice, it becomes so much easier to change it. You still get everything done. You'll still be the same person, but the way that you think, feel, and move through your life, that is what changes who you be. Order your book now, check the links below, and I'll send you a ticket to this live incredible webinar. Now back to the episode.
And that is one of the hardest steps, I think, because there is a serious lack of education among medical professionals around hormones and replacing hormones and perimenopause and menopause. Like when I was in medical school, which, was 20 years ago, but I never even heard about perimenopause. I never heard the word. I never learned about any of these hormones. And the only thing I knew about menopause was that that's when you stopped getting periods and you couldn't get pregnant. And that's like literally all I knew. So I do think that even good doctors don't really understand the intricacies of how loss of hormones or change in hormones can affect you and cause these symptoms. So the hardest part probably is finding a medical professional to help you, a physician or a medical provider of some sort. But I think we are getting more education out there. We're talking about it more. And that's the first step. If you can find someone who knows about these hormones and knows about what to do, that's fantastic. You're on your way.
Yeah, I definitely agree. I'm not sure. It sounds like you're not really seeing clients. Anytime I do podcasts on this topic, I get asked that question, where to turn. And so I will link the person that I send everybody to. And if you've got great people as well, let's go ahead and link them in the
I do.
show notes.
My clinics are certainly still seeing patients, and we've got them in a couple different states. So yeah, I'll give you that information.
Excellent. Yes. Okay. So you find your person.
Yes.
And then what's usually the starting point?
So usually it's going to be a combination of symptoms. So sitting down and just talking to the medical provider, 30 minutes or more, like listening, that person listens to you, which I know is unheard of in medicine. And then oftentimes we'll do some blood work as well. So we'll do blood work to check just, hormones, including, thyroid, estrogen, progesterone, testosterone, cortisol, but also other things like your lipids and your blood sugar and, because all of these things can change in midlife and they can give us clues to what's happening with your hormones. So we'll do a kind of a large amount of just basic lab tests. And then from that information combined with the symptoms, usually we can start to develop a plan.
Okay. So one thing that's so important in this conversation, and I think in some communities, this is just really obvious, and in some other communities, it's not so much, but this is really important. If a woman goes to her traditional medical doctor, I know you kind of said this already, but let's say it again a little bit louder for the people in the back. And they're talking about these symptoms that they're having, and they're expecting this doctor to, one, hear them, and two, order labs. Are they going to get the correct labs?
Maybe not. Certainly, certainly there are some great doctors. There are even doctors who are really good, though, don't necessarily know about this part of medicine because no single specialty has kind of taken ownership of like midlife women's hormones. Even OBGYNs, even endocrinologists, like that's not their area of specialty in general. So they may not, they'll get some of the basic labs, but they may not get, like, for instance, some of your other hormones. They may not get a full thyroid panel. There are some things that they may miss. But I think one of the bigger problems is they oftentimes just don't have the time to sit and talk to you for 30 minutes or an hour. Because of, if you take insurance and you're a medical provider, unfortunately you're paid, you're only paid to sit with someone for about 5 minutes or 10 minutes and you have to move on. So I think that's one of the biggest challenges is, these are complex people, like we are complex people, and doctors just don't have the time because of the insurance model oftentimes to sit and listen to their patients.
Yeah, I think that's a really important concept. I mean, you think about it, and I've heard you say this. I've been playing on your socials and looking at some of your things over the last month or so, and there's one of them where at the end of the information you were sharing, you said ultimately, like maybe not that's not the cool answer, that's not the great answer. I think
Yeah.
we're all searching for like this external thing to grab onto, but ultimately we as women know so much more than we give ourselves credit for. And so when you go to a doctor who doesn't listen, partially because that's the way the system is built, they can miss out on so many key indicators that point answers to what's going on in our health.
Yeah.
So very important. And I just wanted to highlight that because I've had a lot of women reach out to me again after bringing some of this conversation to my platform. And they're like, well, I feel all these things, but I got my blood work done and my doctor says I'm fine. And so now what?
Yeah.
And I think this can be so frustrating when you don't feel right and people are telling you nothing's wrong. And it's not like we want something to be wrong, but it's also that we want answers. And I think digging deeper into the hormonal panels and blood work is a really important piece so that you're getting accurate information.
Yeah, and the thing about the hormones is they change from day to day, and especially in perimenopause, your labs are different from one day to the next. So you can't just rely on the labs. Like your estrogen and progesterone are going to be going up and down like crazy. And so it is normal to have that happen, but oftentimes, we listen to symptoms and labs and we combine them together. So for instance, in perimenopause, it's very common for us to give progesterone because progesterone is one of the first hormones that starts to go down in early perimenopause. And it's responsible for a lot of the symptoms, the insomnia, the anxiety, sometimes weight gain, sometimes kind of estrogen dominance, people call it symptoms that happen in perimenopause. A lot of it's just because you don't have enough progesterone. Your ovaries are not making as much anymore. And so just simply giving progesterone is very simple. We don't even need a lab test to give it, and it can make a huge difference. And what's interesting about women in this stage is oftentimes they'll see 4 or 5 or 6 different doctors before they actually get diagnosed with perimenopause, and then get a single drug like progesterone that really helps, and they're feeling much better. They'll oftentimes get they'll get antidepressants, they'll get pain medications, they'll get sleep medications, they'll get anti-anxiety medication. They get all these medications prescribed to them because they're having this vast, amount of symptoms that are just kind of weird. But it takes 5 or 6 doctors to say, oh, wait, this is all happening because of one thing, which is that your ovaries are just kind of petering out.
Which is so important to get to that root cause because all the symptoms are just arms. They're just limbs
Yeah.
off the trunk of the tree that are all from the same thing. And that's, these are my favorite kind of practitioners to talk to because it's not just covering up the check engine light. It's actually figuring out what's going on
Yes.
under the hood.
Yes, and certainly lifestyle plays a role. I mean, I talk a lot about hormone replacement, but I also am a big advocate, of course, of working on lifestyle and sleep and stress management and social connections and diet and exercise and all of the things that I know you talk about a lot. Those are, of course, foundational, whatever stage you are. But oftentimes, women are doing all of those things, and they feel like they're trying really hard, and it's still not working. And so that's oftentimes when they come to me.
Yeah. I mean, personally, I am not at a place yet where I have felt the need for something. And I've been, digging through all the conversations, the science, what will I do when that time comes? Definitely have in the past been scared about the cancer conversation, which I want to address with you, like cancer and HRT. But also, I have women in my circle that are years ahead of me. And, in my mind, it's like you never say never. But I kind of always thought I would go into this season of my life and like just solely go natural, not use any exogenous hormones. But I have watched very close friends contemplate suicide and then gotten on estrogen or the patch. And, I literally watched my friends lose themselves. And it was very, very scary. And so
Yeah.
now my eyes are open, and I think just really never say never. I'm curious about all of it. I'm open to all of it because at the end of the day, yes, diet, lifestyle, connection, community, all those things. Like you said, that's my favorite to talk about. But also, if you are a mother and you cannot show up for your children, if you cannot show up for yourself, if you are dangerously approaching places of mental health that do not work, like there's a time and a place for everything.
Yeah.
And so the question that comes with that is, okay, there was some information out there that closely tied hormone replacement therapy with cancer. And I know that some of that has changed now. So can you kind of fill us in on that conversation? Where are we at?
Yes. So the information, most of it came from the Women's Health Initiative, which was published in 2002. That's the one that came out and kind of the media went wild and said, oh my gosh, these hormones are causing breast cancer and strokes and dementia and blood clots. And, most women who were taking the hormones got off of them in 2002. Well, we revisited that data as well as other studies that have been done since then and before then, and basically found that these hormones, so it was the synthetic form of progesterone. So it's a synthetic progestin, it's called, which is different than the progesterone that your body makes. That it looks similar to it. That progestin, what was actually increasing the breast cancer risk in the Women's Health Initiative. And in fact, in the women who just took estrogen, they actually had a reduced risk of breast cancer in the Women's Health Initiative. So that part wasn't really that, the media didn't come out with that part, but this is what we know. And since that time, we've done studies that have looked at estrogen, bioidentical estrogen, and bioidentical progesterone, meaning that the chemicals match exactly what your body's making. We're just giving you back those exact same chemicals. And in the studies that have been done thus far on the bioidentical versions of those hormones, there is not an increased risk of breast cancer out to about 12 years of use of hormones. Now, we don't have long-term data. We don't have 20-year, 30-year studies that have followed women using that form of hormones. So, I will say that I think that it is possible that very long-term there could be a slight increased risk of breast cancer. It's possible, but we certainly haven't seen that in the studies we have so far. And what I will say is, even if there was a very slight increased risk, one in 1,000, one in 10,000, something like that, I think you still have to always look at what are the benefits of, for instance, estrogen. We know that estrogen can reduce the risk of heart disease in women by up to 50% if you start estrogen early. Heart disease is the number one killer of women. It kills more women than breast cancer by far at every age, even in young women. And osteoporosis, for instance, women die of hip fractures and back fractures all the time. And we know that estrogen therapy reduces osteoporosis by 40% if we started early. So certainly, I think you have to always look at the pros and cons. And I think that it's possible that long-term estrogen use could increase breast cancer risk very slightly. We don't have that evidence yet. But even if it did, I think you still have to look at, but what is it doing that's good for me that, may be beneficial long-term?
Right. It's like with any drug, not just looking at the one question it
Yeah.
answers.
Yeah. And I think that your approach of weighing the data and weighing, how your body feels about it is a good one. I am pro hormones and I talk about them a lot because I think most women don't have the information. And I think it's important that you have the information so you can make your own decision. It's not necessarily that I want to force any decision on you. I don't. I want you to always choose for yourself. But the whole point of choosing is that choice part. And you have to have the information on both sides in order to make a good choice. And thus far, most women have not been given the choice, and they therefore I think have not always chosen what they would have otherwise chosen.
Yeah, 100%. I kind of also talked about that in my intro because a couple weeks ago I interviewed an amazing woman. You know her, I'm sure, Dr. Nisha Winters,
Hmm.
right? And love her, absolutely love her. And her stance was very much that in 17 years of practice, she never needed exogenous hormones. And so there's that heavy information on that side from a woman that I very much respect. And what I wanted to do intentionally is bring on someone who feels quite the opposite or a little bit of both, right? Because the reality is, as women, as consumers, this is what we're being surrounded by out there.
Yeah.
It's someone saying one thing and someone saying something else. So part of my intention with, bringing both of you on is let's have the confusing conversation together. Let's talk
Yeah.
it all out in this one space, and I think you just nailed it. It's like to get to the place you take all the information, whether it's hormones or biohacking or, whatever it is, how much weight to lift. Do you cold plunge? How long do you cold plunge? Like
Right.
we have got to get back to trusting our inner compass.
Yeah.
And so thankfully we have all this information, but make it our own. There's not a one size fits all. It's one size fits Amy, one size fits me, one size fits someone else. But I am so grateful
Yes.
to have the ability to bring in women like you who I know and trust because I'm like, this is not my area of expertise. And it's clearly yours. So again, I really, really appreciate you being here.
Thank
So
you. Yeah.
I know can you talk to me about the age of your kids? Because I think you've got some daughters that maybe are approaching some hormonal shifts or already have.
So
And I'm
my
curious.
daughters are 17. I have twin daughters, 17, and my son is 15. So yeah, they're late-ish teens, but certainly have gone through, they're in it.
Yeah. So at these ages, I wouldn't imagine from where I stand that you would do a ton of exogenous hormones, but I'm very
Yeah.
curious. And later on in their life, what is the conversation that you'll have with your daughters around what age and in regards to these hormonal tools?
If everything is going well, your periods are good, you feel good, you're doing, your life is great. Like you don't have to worry about these hormones in general. Like you don't have to check them, you don't have to do anything. Just carry on, keeping healthy.
I don't
Great
think
stuff.
there's many people that are doing really, really well these days.
It's and I think that we don't I don't give out these hormones like candy. It is certainly very prescribed to populations. For instance, if you have polycystic ovarian syndrome, which is very common, about 10 to 12% of women have PCOS. It is an endocrine disorder that women have that is underdiagnosed. About 70% of women who have it don't know they have it. So very, very common. And essentially, it basically means that you end up with insulin resistance, like prediabetes, and too many androgens, like too much testosterone, and you can have infertility and problems like that. But one of the symptoms sometimes is irregular periods. And so, if you have irregular periods with PCOS, then it's very beneficial to give progesterone because that actually offsets the high estrogen that you have. And over time, it can reduce your risk of breast cancer and uterine cancer, and also help with a lot of the symptoms you're having. So there are specific reasons to give these hormones that, are disease states or irregular cycles or PMS symptoms or things like that. But if you don't have those things, you certainly don't need to be adding hormones just to add hormones.
Okay. Thank you. There's a lot of supplements out there. There's a brand I use and have loved in the past, and I have some questions. So there's put on your skin vitamins, supplements, as far as hormonal support. There's put in your vagina, put in your mouth. We could say put in your one mouth, put in your other mouth. First question is there one that works better, or does it all kind of depend?
For supplements,
Mm-hmm.
I use supplements. I love supplements. I use, oral forms mostly. Certainly, I don't think I use a lot of transdermal supplements, but I do use oral supplements, and I like them for a number of things. I think that they can be helpful in women who are still making their own hormones and capable of making their own hormones. They're
Okay.
not super helpful for women who are menopausal and not making hormones in terms of helping your body make hormones. You can't make your body make hormones once your ovaries have shut down. You can potentially help with the symptoms, help with the sleep, help with the anxiety, whatever, but you're not going to actually make those hormones again once your ovaries have shut down.
Okay. And so, the one in particular I have used in the past when I travel is a progesterone. Just kind of helps calm the nervous system. It helps me sleep. We travel a lot for work. I'm on the road. Quicksilver, and I put it on my skin.
Mhm.
How do you feel about products like that? As far as like, I didn't show in blood work that I necessarily needed it, but I feel good when I use it at certain points in my life or the season that I'm in as far as work.
So transdermal progesterone, like creams, for instance, like that, which there are some over the counter. I don't have a problem with them in women as long as you're not using them after menopause for uterine protection. So if you're taking estrogen and you're menopausal, you don't want to use a through the skin progesterone because you need to be able to protect your uterus from that estrogen. And the creams they don't get reliably absorbed. So I don't use them in that case. In younger women, like if you're still cycling, I think that progesterones of all sorts, including creams, can be beneficial. Like for instance, during the second half of your cycle, like the 2 weeks before your period, if you're not making enough progesterone, which is when you normally would make a peak of progesterone during that phase, if you're not making enough progesterone, some women do find it really helpful to take progesterone. Usually I just prescribe it so I know exactly how much you're getting, but some women do like to just buy it over the counter and just kind of experiment. I don't really have a problem. Just understand that if you use too much of it or at the wrong time, it can affect your cycles. It can stop you from cycling. It can give you irregular periods. Progesterone of all sorts can have side effects. They're not dangerous, but it can cause bloating or heartburn or things like that. So I would always recommend probably having a medical provider work with you. But in general, I do like progesterone, even in younger women.
With anything I've asked so far, is there anything that sticks out to you that I've maybe missed in this? I feel like it's a little bit of like low-hanging fruit conversation, right? Kind of like I said to you before we're recording, I really want to keep this at a basic level and then let questions come in because I think for the most part, my audience is kind of new to this topic. I didn't want to go too sciencey, but are there things that perhaps we missed or like major important red flags for women around our ages? If you're a woman and it feels like your brain has 47 tabs open, you've got the kids asking questions, texts coming in, dinner to make, work to finish, and somehow you're still trying to think clearly, this is not a mindset issue. It is not a personality flaw. This is physiology and your nervous system stuck in urgency mode. I created this urgency reset, a simple 2-minute shift using brainwave-based tools to help your nervous system downshift so you can come back into clarity and presence. Because the goal isn't just managing the chaos, it's being present for the moments that you don't want to miss. So you don't look back later in life and realize the years with the people you love or just your own life slipped by. Click the links. This is a mini masterclass. It's like 15 minutes, and I cannot wait for you guys to check this out. Back to the episode.
One of the things that I think is important to understand, so loss of progesterone is one of the key things that happen in women when you have a lot of stress or when you're not sleeping well. Your body essentially is unable to make as much progesterone. You're not ovulating regularly, perhaps, and then you're not making. And progesterone is like the hormone that is, it's like the anti-anxiety, it's calming, it helps you sleep. It's like the nesting hormone. Like it's like, ah. And so when you don't have enough of that, you can imagine that the symptoms. And so, a simple fix is working on your stress management, working on your sleep, working on those kind of foundational things so that your body is then able to make the progesterone. So it doesn't have to always be about going to the doctor and getting drugs. It can oftentimes be working with your body and just listening to what your body needs, or finding someone who specializes in those kind of things and courses and breathing and journaling and those kind of things.
Yeah, I think super important. I mean, I love that image of the hormonal hierarchy where it really is. I mean, if we're going to root cause, our oxytocin, cortisol, and insulin really has a massive effect on our hormones. So can
Yeah.
you speak a little bit more on that? Because I speak on it a lot in my communities and platforms, and I want my audience to hear it from someone like you.
Yeah, so cortisol and sex hormones are both made from cholesterol. And if there's a whole pathway that makes them, but essentially the first part of that pathway is making cortisol, and then some of the salt regulating hormones, and then the sex hormones. So if you kind of think about it, some people call it, they call it the cortisol steal or pregnenolone steal, but essentially if you're making a lot of cortisol, if you're super stressed out, if your kind of adrenal system is working on overdrive, that can affect how your body is able to make progesterone, because it's all made from cholesterol. It's all made from the same precursor. And if you're making a lot of cortisol, maybe you're not making as much progesterone. So just every single piece of this hormonal cascade affects each other. Thyroid function is a big one. A lot of women, especially midlife women, will have low thyroid function or kind of low normal. Like it looks normal on the lab test, but it's not normal for you. It's lower than normal for you. And so all of a sudden you're getting weight gain, or you're constipated, or you're losing hair. And that also affects how your sex hormones work. It affects how your estrogen works and your testosterone. So all of these hormones are interrelated, which is why when I see patients, I check all the hormones at one time and don't just zero in on one thing. Because in order to really understand what's happening, you have to understand all the hormones and get a really good complete list of symptoms and concerns, and and talk to the patient about what's going on.
So, in summary, how important is stress management in midlife?
It is so important. It's one of those things when I first started hearing about, how important stress was for health, I was like, whatever. It sounds like super woo woo. It sounds like bogus. Like it sounds like you're just making stuff up. But, stress, we think now stress probably contributes to like 80% or more of diseases in a major way. And it contributes to, it affects every part of your body, from how your brain reacts to your pituitary gland, to your adrenal glands. Like I call it stress overwhelm syndrome, SOS, where essentially it could be like a whole mess of things going on, and it's hard to check for it but you can listen to people, and that's really the best test. It's better than any sort of cortisol test. Is how are you feeling? Like, how is your body feeling? What are the things you're noticing? But stress is a major contributor to everything from cancer to dementia to heart disease to autoimmune disease to everything.
Which is stressful.
It is stressful.
To hear that.
It is stressful.
So what do? We have stress.
I know.
Yes, I know it's not good for me. And now
Yes.
it's chipping away at the years of my life, not just the life of my years.
I know it's so hard. I mean, I certainly I'm not a guru, but one of the things that I tell myself a lot is that stress is like it It is how I perceive a situation. Like the situations are not the stress. The stress comes from how I perceive the situations. And so certainly there can be a lot of bad things happening, a lot of things in my life that are stressful, but they only really become stressful if I perceive those things as being so. And it doesn't always work, I have to tell you, but I do feel like a lot of times I'll just tell myself it's really just a reframe. Like, does this have to be stressful, or is it just something that's going on over here that I can like react in a different way? And I've tried to help myself react in a different way.
Yeah, I love that. I mean, really, we're mammals and we're designed to have this short, stressful event, react to
Yep.
stay alive, and then regulate. And we as humans just have elongated that regulation period.
Yeah.
So that's so simple. And I'm not going to say it's easy, but I can hear it. That is so important just to put it in check. Like, is this actually as big as I'm making it? Is this going to matter in 6 months? Is this going to
Yeah.
matter in a year? Is this going to matter in a week? Really?
Yeah. And does me being stressed about it make a difference? I mean, even if it does matter, is it going to make a difference that I get super stressed out and can't sleep and can't think and can't work? Like, does that help it at all? Because if it's not helping the situation, then maybe I need to adjust my reaction to it. And I think also like other tips, like just, for me, staying off social media, not like letting myself get wrapped up in scrolling for hours a day. Like that's a big one. Getting out in nature is a big one for me because I live in Utah and I have nature trails right here. So if I can just go out, unplug, talk to the mountain lions, that's helpful. So, I think there's certainly practical tips also, but the sort of mental shift of like what is actually stress and thinking about it like that is also pretty powerful.
Yeah, I love that. I always love to have something like tangible to kind of anchor onto, and you just really hinted at it. But, if we go back to like the hormonal hierarchy and cortisol, and we've all got this high stress and we know it has a huge impact on us. I love to, look at like what's bad, stress. Let me turn to what's good, oxytocin. Right. So can you talk a little bit about oxytocin and how do you proactively make sure that you create it in your life? Because I know you're very busy.
I love Yeah, oxytocin is a fantastic hormone. It's the yin. It's like the opposite of cortisol. When oxytocin's up, cortisol is down. And oxytocin comes primarily from kind of close relationships with other people, whether it's hugging, kissing, sex, which I'm a big fan of, or even dancing, sitting with your kids on the couch, holding hands, hanging out with your girlfriends for a night out. Like all of those kind of community connections, personal connections, intimacy, all of that is going to increase oxytocin. And it's so powerful. I mean, we know that social connections are the biggest thing. Like that's the best thing you can do for your health long term is have close connections to others. And a lot of that, some of that's oxytocin and stress related. There's probably other things going on, but I think making time for that is important. And I definitely have seen in myself and patients ever since kind of COVID, when we all kind of became reclusive and we didn't leave our houses. Like a lot of us have still stayed that way. It's so much easier to stay on the couch and not go out and not do the girls' night and not, do things like that. But I've been trying for myself and my patients, like go out and do the things and meet the people and, and be part of the world again, because I do think it's so important for health.
100%. Okay, let's talk about sex. I think this is really important. I've seen you talk a lot on this topic. And as a hormonal expert, let's talk about it because I think for a lot of women in this stage of our lives, we could get really inundated with all the tasks and the to-dos. And we could
Yes.
kind of forget about our partners. And this is so important, not just for them, but for us. So
Yes.
why do you love the topic of sex so much in your field?
I think, sex, no one talks about it, which is part of why I think it's so important. Like we know that there's interesting correlation data in both men and women that people who have sex on average about once a week have about 50% lower all-cause mortality rates over time, like 50% lower risk of dying during the course of the studies. Now, certainly that doesn't mean having sex is going to make you live longer, but there is a strong correlation between sexual health and general health and longevity. Because when you think about sexual health, it kind of sits in between all other forms of health. Like certainly physical health is important. You have to have blood flow to the area. You have to have the hormones, that are appropriately acting. You also have to have the social health, like a partner, if you're going to, if you're going to do partner sex, and you have to be sort of mentally and emotionally healthy. Like we know that, when people who have a lot of depression or anxiety or things like that, maybe they don't want to have sex. So all of these things have to kind of come together in order for you to be sexually healthy. And so it's a kind of an indicator of health as well. But also we know that having sex either alone or with a partner, just the act of it, all the hormones and neurotransmitters that are released are so powerful. It decreases your pain, for instance. So we see less pain in people who are having an active sex life. We see lower blood pressure. We see a better immune system. We see less depression and anxiety. There's all of these sort of other health metrics we can look at outside of just the healthy relationship, which obviously is very important, that tell us that probably a good thing. Obviously, it has to be a healthy sex life. It can't be a bad sex life. It can't be forced on you. But if it's happening the right way, it can be a really powerful wellness tool as well as just a social intimacy tool with your partner.
Yeah, 100%. I mean, it gets you out of your head and into your heart, that's for sure.
Yeah,
Right? If we're walking around in chronic stress and living in fight or flight in our sympathetics, I mean, sex is parasympathetic. It's an
exactly.
oxytocin boost. Yeah. So for the women in the room, in case any women, have questions on this or want to chat about it, because I think this is, like you said, it's a topic we don't talk about, but it's something that unites us all. It's literally one of our functions of survival. You've talked
Yeah.
about that. What are the
The four
four F's?
F's.
What are the four
Yeah,
F's
the four
that
F's.
drive us?
Yes, the feeding. Wait, now I forgot what they all are. Feeding. I know one of them.
Fight.
I know what the last F is.
Yeah, it's like feeding, fighting, fleeing, maybe,
Fleeing. Yeah.
and and
Yes.
sex.
Yes. And sex. Yes. That is. Yeah. And I did a talk on that. And I was like, what are those? What are the four F's?
It's
It is.
yeah,
It
it's
is.
on your
It is a primal. It's a primal survival drive, for instance, for sure. And I think that a lot of us, including me, like I'm so stressed out with all the things I have to do, like with my to-do list, which is always super long, and then it's like I'm like, I don't have time. I don't have time. I don't have time. But I have to tell myself, like, you have to make time. So don't let that slip, because it is really important for you and for your partner.
Yeah, and I think it's also an indicator of like how, over masculine, and I don't mean this gender wise, I mean how over masculinated our schedules have become. It's like to do, to do, to do, and we've become very robotic and very linear instead of remembering that, especially as women, our power is in who we be. Like we are human beings. And I think the lack of sex is a symptom of a bigger problem.
Yeah.
I think it's our lack of connection with self. It's our lack of remembering to play and to be. And yeah, I think there's, an individual responsibility. And I think there's also a partner. I mean, I tell my partner, foreplay is all day, man. Foreplay is all day.
100%. It starts with you doing the dishes in the morning.
Yeah. And like, it can't just be, we can't just be in work mode and then they come up. And I mean, sometimes that's really hot. But like we kind of need the buildup. We need the
Yeah.
snuggle. We need you look really hot. Like I need the eye stuff.
Yeah.
So if you have patients that aren't having sex, like, or what are some of the things that you do in your life to make sure that this is happening, because it is so important.
I mean, I think it's not a problem to schedule it also. Like certainly I understand like that maybe is not cool and it's better to be like impromptu, but if it's not happening without you scheduling it, it's totally fine just to put it on your schedule, or talk to your partner, be like, all right. Or if you're not don't have a partner, I also think it's great to schedule it by yourself. And make time whenever it works, if you can. And then also just trying to do things that make it exciting, whether it's date nights or dressing up or like whatever is exciting to you. We'll try to make time for that. And honestly, for women, I really think it's a lot of like being able to shift into that parasympathetic mindset is so difficult. And you have to be in that in order to have like a satisfying sexual relationship or moment. And that's like the rest and digest, or what I like to call the rest and receive, like being in this place where you're like open to receiving, pleasure and compliments, and like someone else doing the work and you not doing the work. Like being in that place is really hard for us because we're used to being like, go and do and get and give. And now we're like, oh, well, you want me to just be and receive? And that's really hard. But I think that mental mindset shift is also really important if you want to make sex a priority.
Yeah, I love that. I mean, it goes back to the masculine, like we're living in our to-do lists. And as a female, our power is in that beingness. It is in receiving. It is in being taken care of. And so it's such an important flex and practice for us as women. I just want to touch on what you said about scheduling sex, because I think it can be very romantic, actually. And I think for some of us, it might be the reality of what it has to look like. We've got 3 small children, not super small, but it
Yeah.
sometimes has to be talked about, leading up, but that can be really exciting. I mean, it opens the door to sexting and I can't wait for tonight and oh, what I'm going to do to you. Like we can take what we have and make it incredible. And I think this is where we win at life. Like mine doesn't look like my best friend's. She has a very different situation. She has
Yeah.
locks on her doors. We don't even have locks on our doors.
Yeah.
But making it our own, and I think this applies as well to the hormonal conversation. It's make it our own.
Yeah, I think that's absolutely true. And with sex, there is no right way or one way. And certainly, we have some studies that suggest that, probably a little bit more is maybe better than never. But that doesn't mean that was going to work for you. Like there are certainly women who don't ever want to have sex and they're very happy with that. And that's totally fine. Like it's all a place of what works. What do you think works for you? But then once you feel like you have a plan, like do make some effort, do take some steps to execute that plan. Like don't just kind of wait for whatever to happen. I feel like it's being educated, being proactive in whatever way you want to go that's going to work for your, whatever health journey you're on.
Yeah, I love that. All right, I know we're on a time crunch, so just kind of wrapping up, I want to know from you, this year, what are you doing with all that with all that you're juggling? Like, what are you doing for you so that you show up as your best self with optimal health?
The biggest things I focus on for myself are making sure I'm sleeping 8 hours a night because I really need, if I don't have a good sleep, I'm kind of worthless. So I focus on sleep. I am really focusing on trying to play more. And that for me is like, mountain biking, for instance, or hiking, or just getting outside and doing things that are fun, but they take a little time. Sometimes I'm a little resistant because I don't want to be away from like my computer or my Zoom calls or whatever, but I'm trying to make more time for play and for my family. And my kids are going to go to college soon, and I know that if I don't make more time for them now, I'm going to regret it. So that's my priority as well.
I love that. When you do make time to go mountain biking, how do you feel?
Oh, I feel so good. I feel so good. And I always afterwards, I'm like, okay, I'm going to do this more. And then I always want to, but it's always like, well, yeah, but can I afford 3 hours away from, these other things? And I have to just tell myself, yes, you can. You just make time.
Yes. Well, I'm excited. I know after this, we're going to hop on an IG Live, and I want to talk all about that because play is so powerful,
Yes.
not just in our life, but, in the hormonal conversation. Amy, thank you so much for being here. I think this was like a really good kind of basic landing point where people have a lot of information to walk away with. You guys definitely, if you're watching this on YouTube, drop your comments below, drop your questions. Like, my goal is to create community. We're told we need a village as women, and the reality is a lot of us don't have it, but here's a way that we can be proactive. Comment what you got out of this conversation. Comment something vulnerable or like what's working for you or what's not. Like I monitor these closely. I can tap into Amy's brain and come back to you guys with some feedback and information. Amy, anything you want to leave these incredible listeners with?
I just think that you have so much power over yourself. Like you have so much power over how you feel, how you age, how you go through life. And I encourage you as well as me and all of us to just kind of know that you have that power and seek ways to make it even stronger.
Ah, love that. We so need that message so loud at this time. Thank you so much, Dr. Killen, for being here. And I look forward to seeing you, I'm sure, on the road at some conferences and staying in touch over social media. We'll put all your links below. And if you guys have any questions, comments, go ahead and drop them or email them to me. Thank you so much for being here.
Thank you. Bye-bye.